Hi, my name is Tim Hill and my company is Utonic, and in this video I'm going to show you what are the causes of lower back pain and how you might be able to try and get rid of them yourself. So what we're going to look at first is the pelvis. So what we ideally want is a pelvis that is neutral or level, and we have a lumbar curve and we have a kyphotic curve here, and we need those for shock absorption and moving basically. So the common postural type is this one. So tight hip flexors which tip the pelvis forwards or anteriorly. So what we then have is we have tight hamstrings, but they're not the problem. So the problem comes from the tight hip flexors. So stretching your hamstrings isn't going to help the problem. If anything, it's going to increase it. So it's not that the hamstrings might be tight, but they're probably elongated and weak. So they need strengthening. This needs to be lengthened. So this postural type here is what's known as a sway bike. You don't really see it very much these days because most of us spend too much time sitting. But this would be tight hamstrings, elongated hip flexors. But as I say, it's so rare, I just don't see it. So you're more likely to see a combination of two things, and that being where you get like a bit of a shift. You get sort of hyperextended legs. You have tight hamstrings, but you'll normally get an element of tight hip flexors as well. So similarly, what you get is, in terms of the areas where you can get discomfort, is in the lower back and the neck. Same with this one, you'll get a bit of lower back and the neck, and the same with this one, lower back and the neck. So what we're going to do is, if we look a bit closer at the hips and the pelvis, so what we see here is that there is your spine, or my artistic impression of your spine, this being your pelvis. So basically when this gets short, this is what then increases that lumbar curve, and then all muscles work in pairs. So the easy example will be, say, your arm. If you imagine in terms of my arm here, if this was short, then it stops my tricep from working. Or if you look at it the other way, if the tricep was locked short, then it's going to stop my bicep from working. So in this example, we're looking at the hip flexors. The hip flexors becoming short, they're going to create an inhibition on the glutes, so it's going to make it harder to work. So then basically the thing that then kind of holds the pelvis level is the hamstring, or it doesn't hold it level, but it ends up on the stretch. So what we want to try and do is get the hip flexors looser, which will then allow this muscle to switch off, because it becomes used as a postural muscle when it shouldn't be. Its role is more to sort of stabilise the knee. But basically say in terms of, we then need to actually work on strengthening up your glutes. So what we're going to go through in the following exercises is ways that you can effectively loosen off and stretch your hip flexors yourself, and then we're going to look at how you can then work on building up some strength in your glutes. Right, so with the foam roller we're going to work on one leg at a time, and basically what we're going to do is try to work from the knee up towards the hip. So there's a muscle called rectus femoris, as we've already mentioned, and that crosses the knee joint, so it also works as a hip flexor. And that's quite important. So you're trying to go from the knee all the way up to the pelvis. And with these, what you're trying to do is basically go at a rate that it feels like your body is releasing. So you can use, if you want a little bit less pressure, just put one leg on at a time. If you want a bit more pressure, you can rest the other leg on top. And again, with these, you're thinking about trying to go at the speed that it feels like your body's actually releasing. So in terms of, if you looked at the muscle in real term and you looked at the fascia, the fascia is like a matrix, and blood can actually pass through it. So if you think when you sort of squash it and compress it in this way, you're actually kind of forming a little bit of a well and trying to get blood to move through that fascia. So in that way, you're basically going at a rate that actually it feels like it's allowing you. So if you find a spot that's sort of particularly uncomfortable, so in terms of, don't like using the word pain, but discomfort. So what we're looking for is a maximum of about an 8 out of 10 in terms of discomfort. And when it feels like it eases off back down to about a 3 and a 4, that's when you want to move on to the next spot. So you might find that sort of in different spots you've got tighter areas and looser areas. So normally around that muscle tendon junction, so quite close to the knee, you might find that there it's a little bit more tender, and you might find sort of as you get about a third, 2/3 the way up, it's less tender, and then you can actually roll a bit quicker then, because you're not really influencing too much there. But in terms of where you want to try and work, if you want to try and increase your range of movement of the muscle, is into those muscle tendon junctions. So that's where your Golgi tendon organs are, and they greatly influence the length of the muscle. So you're thinking about just basically going just above the knee, and so we're mainly working into that rectus femoris muscle, because that is the one that really influences the hip flexibility. So we'll do the same on the other side. So again, just starting just above the knee, and again you can either put the other leg on the floor, or if you can handle a little bit more pressure, then you can rest one leg on top. And again, we're just going to do this until it feels like it has loosened off a little bit. And this is the sort of thing you want to try and do daily, you know, especially if you do activities daily such as cycling or running. It's a good idea to try and keep these muscles nice and loose. And you might find that one side is tighter than the other, depending on, you know, on other activities. So try and spend the time on the one that actually feels the tightest. Okay. So after we've done that, the next area we're going to try and work into is up here. So sort of like say closer to the top of the hips. So what you've got there is you've got the origin of your rectus femoris, but there's also another little muscle that works as a hip flexor called your tensor fasciae lata. So for that you probably want a massage ball, something like this or something like that, and then you can try and work into that tender spot. So say it's just below the bony part on the front of your hip, or your ASIS. So again, so with this one, just basically aiming to use a little bit of pressure. So it's going to feel a little bit uncomfortable, and just stay on that spot until it eases off a little bit. So again, go to a maximum to an 8 out of 10 in terms of discomfort, and when it feels like it's eased off to about a 3 or 4. Then you move on to the next tender spot. So you will find a few of them, so you might just roll around and actually physically search them out. And then again, when it feels a bit looser, just swap sides and then work onto the other side. So again, just looking for the bit, just below the little bony bit on the front of the hip. There'll be a little bit that's uncomfortable. It's kind of a sausage shaped muscle, the TFL. And obviously in terms of your rec fem, you're looking for just below the bony part and a little tender spot. So again, maximum of 8 out of 10 in terms of discomfort, holding that compression for a maximum of 10 seconds. And then when it feels like it's eased off, then your work is done. So next, femoral nerve glides. So what we'll say, in terms of the tighter our hip flexors get, they have the potential to actually try and trap the nerve, and then that can create a shortness in itself. So what we're going to look at doing first of all is just trying to do a little bit of self-massage around the area of the psoas, and then we're going to try and do a bit of gliding. So say a bigger ball or a foam roller works quite well. You can't do too much, but you can just get into your psoas a little bit. So starting on the front of your pelvis, and say, when you can see the hip flexors on muscular torsos. So if you start on the pelvis, on a little bit that's just a little bit uncomfortable, and then just roll just above it. Try not to put too much pressure in, and then as you roll around onto the side, you should feel that the psoas basically. And I say you can't do a huge amount, but it will get into the fascia and just help when you come to stretch them. So from there, you just rolling round onto the side. And again, in here, the muscle kind of disappears basically. So one of the hip flexors actually originates on the front of the pelvis. So it's quite difficult, obviously, to get in there unless you're going to try and dig around using your thumbs. So again, same thing on the other side. So if you start on the pelvis, so just where the psoas crosses, so there'll be a little bit that's uncomfortable, and then again, you just roll just above it, and again, you should feel yourself on that muscle. And as I say, if you've been cycling the same day or the day before, you will feel it, because it does get quite tight. So again, you just just slowly roll around at the rate that it feels like it's loosening off. And again, so this one feels tighter on me today. I did some driving yesterday, so that has the potential to tighten on my hip flexors, and especially on that right side. So this one feels tighter than the other one. So again, I'm just basically going at a rate that actually feels like it's loosening off. So the other side didn't feel particularly tight, whereas this one does. So I'm just gradually going to roll around until it feels a bit looser. But as I say, you can't do too much here. It's mainly sort of on the front that you can do something to it. Okay, so femoral nerve glide. So what we're going to try and do here is basically you lie with our hips flat on the floor, and then all you're going to do is just basically bridge up to the elbow. So if you think the nerve obviously goes from your brain down to your hip flexors, and what we're trying to do is we're trying to get the thing sliding through the tissues. So with this one, we're just going to do one side at a time. So you start by letting your head drop and lifting your foot up. So just bending from the knee, keeping the hips on the floor. And then from there, what we're trying to do is then lift the head and let the foot drop. So all we're trying to do is just get the nerve to move through the tissues. So it's head down, foot up, and then head up, foot down. And I'm just going to do 5 of these on one side. And then from there, to try and stretch the nerve a little bit, you can then try and lift your head and bend the knee at the same time. So it's with this one now, you're doing head up, foot up, and that will just stretch or tension the nerve a little bit more. So again, all of these should be pain free. But one way you can sort of discover if you've in terms of if there is a bit of entrapment, we'll just do the other side first again. So dropping your head down, lifting the foot up, and then lifting your head up and then foot down. So it's head down, foot up, and then head up, foot down. So as I was saying, in terms of if there is a bit of entrapment, if you've ever had a change of sensation on the outside of your thigh, then like a little bit of numbness or sort of just slightly sort of tingly, then it's probably a bit of femoral nerve entrapment. So again, so moving on from that, we're doing the head up, foot up, so that one stretches it a little bit more. Okay, and then from there, what we're going to do is just come into a kneeling lunge position, and the goal of this is to try and get the knee basically behind your hip. So we'll just do a few stretches, try and encourage that movement to begin with. So make sure when you do this that your torso stays upright. So if your torso bends forwards, then you're not getting any stretch here. So what we've got to try and do is we've got to try and extend the hips, so keeping the torso upright. And then from there, what we're going to do is we're going to reach up and across, and then let our head drop at the end of the movement. So again, so it's reaching up and across, and then again let your head drop. And again, just going to do 5 of these. So reaching up and across, and then letting your head drop at the end of the movement. And then again, swapping sides. So same thing. So again, just beginning by trying to get the knee behind the hip. That is the goal. Remember, keeping the body as upright as you can. And then from there again, so reaching up and across, and then letting your head drop. So you reach up and across, trying to extend your hips, and then let the head drop. And again, just doing 5 of these. Okay, and then in order to stretch the quads, what we're going to do is try and keep your knee in extension, and if you need to, you might need to get, if you're particularly tight, you might need to use a towel or a belt or something like that. So the idea is not to worry too much about trying to get your heel in towards your bum. The main thing is trying to keep your knee behind your hip, because what we're trying to do is stretch the hip flexors. So initially just trying to hold that position, and then basically as it feels like it's easing off, you can then try and bring the heel in towards the bum. But if you find that when you pull the knee in you end up flexing the hip, then that's kind of pointless, because what we want is we want to try and open the hips. That's the goal. So basically only pull as far as you can actually maintain and keep that hip in extension. And again, if you're looking to develop the length of these muscles, you want to hold these for about 30 seconds. And then again, same on the other side. So just trying to get that hip into extension to begin with. And then from there, grab hold of the back leg, and as I say, try and keep the knee behind the hip and the body upright. Don't worry about how far in you pull it to begin with. Just try and work on holding that position. And then as it feels like it's easing off, you can try and pull in a little bit more. But again, trying to keep that knee behind the hip all the time. And obviously when you do this, make sure you've got a good comfy mat or a pillow underneath your knee. You don't want to put any additional stress on the knee itself. And as I say, it's something you've got to try and work on every day. But one thing that will really help is doing the glides. That definitely helps. Another thing you can try and do to try and get the pelvis moving, because sometimes it does get a bit stuck. It's not really measurable how far it can move. It only moves by about 1 millimetre. But you can try and actually work on, if you like, immobilising it. So you're not trying to do an aggressive stretch, but what you're trying to do is just get in this position. So knee behind you, foot flat on the floor in front, and as I say, you're not trying to make an aggressive stretch, but you're just trying to push your bum down towards the floor and then lift off. And all you're trying to do is encourage the pelvis to move. You're not trying to sort of create an aggressive stretch that's likely to tear anything, but it's just to try and encourage the pelvis to actually move. And again, if you do the same thing on both sides, you can actually reassess to see if it's actually done anything. Because often when you do this, when you try and go back into this stretch again, you'll find it a lot easier. So give that a go as well. So as I say, yeah, hope this has been useful. If you have found it useful, then please give it a thumbs up and consider subscribing to this channel. Also, what you might want to consider doing is joining my stretch and roll classes, where we go through all of these drills, and we also work through so we work through a lot of self-myofascial release and stretching, and then as well as that we then strengthen the sort of common postural muscles and stabilising muscles that we all need basically, and often get neglected when it comes to our workouts. And then also I'll put a link at the bottom of this. The next thing you need to work on is looking at the glute strength. So there's a link at the end of this video which will take you to how you can work on doing deadlifts. The other thing you might want to consider as well is coming to my online kettlebell classes. They start from beginners, so I've got beginners, intermediates and advanced classes, and they're a great way of strengthening your core and your glutes and really working on sort of the anaerobic fibres as well that you need for stuff like running and cycling. So obviously say pure strength is great for barbells, but yeah, kettlebells really work very, very well, and they're just easy to access because you can do them at home as well. So yeah, hopefully see you on the next one.